Hello and welcome to the trigger points of the week. This week we're going to focus on the lateral pterygoid muscle. In terms of pterygoid muscle, sort of maxillofacial, craniofacial pain, the lateral pterygoid is extremely important, especially for symptoms like temporomandibular joint syndrome or disorder. In terms of the anatomy, there are two heads. The superior head on the lateral surface of the greater wing of the spheroid, and the inferior head, which is also from the sphenoid, the lateral pterygoid plate of the sphenoid. The heads insert into the articular capsule of the disc, hence the intimate relationship with the temporomandibular joint, and also into the neck of the mandible itself. Small, short, very powerful muscles, obviously muscles of chewing and mastication, and often the source of intense symptoms. In terms of referred pain, we can see there are really two maps. We've got the map around the TMJ itself, and then this sort of map going along the zygomatic arch. In terms of the indications, we've talked about the TMJ syndrome or disorder, but other sort of craniomandibular problems with chewing or mastication, also interestingly associated with tinnitus. We know tinnitus is a very difficult condition to treat, so well worth looking for trigger points in the lateral pterygoid for that. All sorts of headaches and sort of jaw pain, including things like trismus or lockjaw. Differentially, we would try and sort of differentially diagnose with arthritic joint pain, also tic douloureux, trigeminal neuralgia, and of course something like shingles that would cause this kind of map of pain. In terms of corrective actions, there are various trigger point techniques we can use. One of the really good ways for diagnosing is to have the patient lying on their back and using a palpating finger in each ear, ask the patient to slowly open their mouth and see which side the TMJ deviates. And the side it deviates to, the shorter side or the tighter side, is often the side that will have the trigger point in the lateral pterygoid. Now, obviously, there are other things that can cause that, but as a rule of thumb, we find that a very useful technique. So we hope you found this useful, and we really look forward to seeing you in the future.